Senate Bill 24 is our Hospital Medicaid Financing Program Act. It would continue Georgia's participation in the Hospital Medicaid Fund that the federal government administers. Today, we do that by legislative action directly. We would align that at the Department of Community Health, who already administers this program as it relates to nursing homes. We think that would add flexibility to Georgia's participation in the program, given the uncertainty in the healthcare market nationally and the dollars that flow down to us at the state level. If that were to cease, then we would be able to more quickly get out of the program. The program is essential to the way we administer hospitals, particularly in rural and high Medicaid population communities in Georgia. Absent our participation, conservative estimates are in the neighborhood of 10 rural hospitals. I've heard estimates up into the dozens of rural hospitals that would likely close operations because they would not be able to participate in the program. The reason that is because by participating in the program, Georgia is able to supplement hospital reimbursements for Medicaid by 11.88% over the Medicaid rate. Without that supplemental pay, these hospitals that are highly dependent upon Medicaid would not be able to make their books balance and would have to close. This would obviously be an access to care issue in those communities, also be a loss of jobs and employment in those communities, but it would also then put pressure on the balance of the hospital network around the state. In my regular job, my out-of-the-session job, I'm a health plan administrator for a self-insured fund at my employer. Without this legislation, the business community faces an increased burden at hospitals and at medical providers because we will not have those matching dollars coming down from the federal government. And without those dollars, Medicaid reimbursements have to be reduced. That's the only mathematical option we have in Georgia. And that's going to come on the backs of the private pay community because providers, hospitals, doctors alike are going to have to increase what they charge the balance of the paying community to offset their losses in the Medicaid world.